Hello, my name is Sungyu Lim, and for my oral presentation for BIOL 54, I will be talking about digestive disorder. Now I will talk about what is digestive disorder, and I would like to start with the place that it is happening. It is happening at the digestive system, which is the gastrointestinal tract, the GI tract. And the GI tract is made of esophagus, stomach, pancreas, liver, gallbladder, small intestine, and large intestine. The GI tract does digestion, which is very important for breaking down food and drinks into smaller parts. Nutrition, and nutrition is very important because it is the energy source of our body and it helps children to grow and cells to repair and build blocks for the cells too. So if there's a disorder in the digestion, all the things cannot be happening. So it gives a huge negative effect and not good for our body. The digestive disorders range is from mild to serious, and the meaning by mild, it will be just few days or like a week of just not feeling good, but meaning by serious is you're having digestive disease and that could affect you to death. So now I will be talking about the digestive disorder trends over the US. Every year, 60 to 70 70 million Americans are diagnosed with a digestive disorder, and 48.3 million people are visiting as ambulatory care because of digestive disease. This incidence and prevalence of most digestive disease increase with age. So every year you get older, the chances of getting digestive disorder is increasing as well. You can see that US is in the first place on mortality from digestive disease is not good. And if you see the graph on the right, that is the digestive disease mortality of United States, not the whole world. As you can see in the graph, it gets higher, way higher every year passes. The latest year is 2018, and it shows that it reached the highest death number, which was 107,719. It's getting worse and serious. We need to really take care of our digestive disorder. So how does digestive disorder is occur? It starts by lack of ability to accurately breaking down the macronutrients, which is like the carbohydrates, lipids, protein, and we leave opportunistic organisms to do the digesting instead for our body. So as the organisms work more, they cannot make more digestive enzyme and secretion enough to break down the foods, and that leads to digestive disorder. So there are a few acts that people make push more into making digestive disorder. Are first, per chewing, we have to chew more to have pancreas to not make additional enzyme. And second, having lower HCl. Third, having lower enzymes. Enzymes is made from pancreas, which break down carbs, protein, and fat. So, but when we eat high sugar diets, the pancreas are tired and cannot work, making carbohydrate to ferment to make gas in our body. It's not good, and to have like a full gas in our body, we need to exhale it out. And fourth, having lower bile is not good. And fifth, making our body to partial digestion is not good because since enzymes and bile do almost 90% of the digestion, the left partial digested food will start to ferment and putrefy, leading to symptoms. So, like I just said before, the gases in our body will get like stuck and higher, and that's not good. And lastly, making our body to bacterial overgrowth is not good as well. There are a lot more like acts that humans do that occurs digestive disorder, and those are like overeating, like drinking carbonated drinks, drinking caffeine, smoking, and lying down like right after we eat. So if those like we keep doing those things, symptoms of course occur. And the first thing is the first symptoms are right side stomach pain, which is the place where the stomach is. Second, silent but deadly gas. The gas, like I just said before, we need to exit how it won't smell good. Third, excessive burping before or after meals. Fourth, fall asleep after meals. Fifth, heartburn. Sixth, excessive toilet paper use. And seven, bouts of constipation or diarrhea. So if we keep like, oh, why? Okay. Oh, so if we keep doing the ignoring the symptoms and keep doing like whatever we want, we are obviously getting the digestive disease. And the most common digestive disease that humans are having right now is the gastro esophageal reflux pathology, which is GERD. GERD occurs when food particles in the stomach rise into the esophagus, and when the foods rise up to the esophagus, it goes with gastric juice that is produced in the stomach, and that is very acidic. So it will be not good in any kind of organs or like things that it touch. And even esophagus is not designed to cover the effects of gastric juice. So if it goes backwards up to our esophagus, yeah, it is not good. It will That's the effect. And a weak esophageal sphincter causes gastric reflux. And if the sphincter expands in inadequate time, which is not in a proper time, the stomach contents goes up to esophagus as well. The hiatal hernia is a condition where an opening in the diaphragm lets the top of the stomach move up into the chest. So this lowers the pressure in the esophageal sphincter and raises the risk of GERD. So yeah, it increased the GERD. So what kind of people are commonly having GERD is that the people who are overweighted or obese because of increased pressure on the abdomen, and people who are pregnant as well. And like I said before, people who just write down right after they have a meal. That's not good. So the second common digestive disease that people have is the inflammatory bowel disease, which is IBD. It is a term for two chronic inflammation of GI tract, which is Crohn's disease and ulcerative colitis. The exact cause of IBD is actually unknown, but it is the result of the body producing inflammation as it mistakes normal bacteria that travel along the GI tract, like as a harmful virus, fungi, and other invaders. Um, so there are a lot of differences about these two chronic inflammation of GI tract, the Crohn's disease and the ulcerative colitis. And you can see in the picture, the effect parts are very different because you can see in the Crohn's, it's very separated apart. But if you see the ulcerative colitis, it's directly in the large intestine. The damaged areas are different as well. The appearing in the Crohn's disease are like next to areas of healthy tissues, but on the ulcerative colitis, the damaged areas are continuous at the place that it occurred, so it's getting larger and larger. Um, the inflammation for Crohn's disease may reach through the multiple layers of the walls of GI tract, but in ulcerative colitis, is presented only in the innermost layer of lining of colon. There are some same parts of IVD as well, is diagnosed using combination of endoscopy, that is just for Crohn's disease, or colonoscopy, that is also just for ulcerative colitis. The same things are the image studies such as contrast radiography, magnetic resonance imaging, which is MRI, or computed tomography, which is CT that we know. Um, so to not get the digestive disease or digestive disorder is to do the treatments that I wrote over here. So first, knowing my digestive trigger is very important. Like many things can trigger digestive upset, and they are all different by person to person. Like I have lactose intolerance and I know that, so I'm really aware of it. Like I really don't want to like even watch your milk. And second, balanced diet that keeps digestion on track is also important too. And three, stay hydrated, but with care. You need to drink a lot of water because it's really important source of our body too. But it can also help keep stools soft but solid and well formed. Fourth, managing stress for digestive tranquility is also important. And lastly, take charge of your digestive problem. You can really go to the hospital and talk with your doctor about like the details and feedback, and you can see your conditions as well. And that was it. And these are my resources. Thank you for listening. Take care.